Hey everyone, welcome back to my channel. If you're new here, my name is Joel. I'm now a nurse graduate from Imperial Valley College and I'm currently working in the ER as an RN. And for today's video, it's going to be my view of dealing with failure at nursing school. Now, this is a really touchy subject, at least for students who are like currently in the nursing program or in the first 2 semesters of the nursing program, because once you get out of this, I guess, feeling, everything starts feeling a little bit better. But everybody learns in different scales and different views. Some people learn it the good way, some people learn it the hard way. So for me, I tend to be kind of like a hard way person, so something really has to stick dramatically in order for me to like get the message. So whenever I failed in nursing school, which was more in first semester in theory exams, but after I got this message across from my brain, the second, third, and fourth semester felt easier in the sense that I didn't have too much pressure. Now, excluding the caveat that every time there was an exam coming, I did feel anxious, I did feel nervous. I really cannot be the person that can always be chilled even during exams. Like, you do have the tense anxiety that is normal, but aside from that, you know, in the lectures or in studying, after I got these 5 tips that I'm going to show you, I began to feel a little bit more at ease. Okay, so the first one is, don't take it personally. So if you pass by a lot, I mean by barely the minimum, which is like a 78, or you bombed it. There was one exam in first semester that I got a 55 on. That was horrible, and it was 55 out of 100. And I remember like my professor was like, "Hey, like, are you okay?" And I think it was like the 3rd exam that we took, because I think in first semester for fundamentals we had like 14 exams. So it was like the 3rd one, and I remember it was lowest, because you can see like in Canvas like the highest, the lowest, and the median. So yeah, with me I was like damn. But even the professor was like, "I don't know if you're gonna make it, bro," but I was like, "Hey, trust me, like, we'll get there." So the first one, don't take it personally. Like, don't think that you're dumb, or don't think that you're not worth it. You're probably gonna start feeling like imposter syndrome, like, "Oh, this is for me," or something. Understand that everybody feels like that. Understand that we all go through that phase, even if it's like for a couple of minutes, few days, few weeks, or even months. But understand that people have been in your shoes, and we have all failed at least one exam. It can be by a little. At least in nursing school, a 78, and my college was barely passing. So if you got a 77, you didn't pass. So if there were like a couple of exams that I got like a 77, 76, and then 55, so it wasn't by a lot most of the time whenever I wouldn't pass, but it would still be that same feeling, right? Especially when you knew like your friends passed and everything, and they were all happy about it, more relieved, and you were like, damn. So the first one, don't take it personally. Don't feel that you're dumb. Don't feel that they're smarter than you, because it's just a test, and some people are really good at taking tests, and some people are good in applying it, you know, in whether it's in a clinical setting or in a research project. So don't really just, it's not like a black and white thing. It really does matter a lot of different other factors in order to see if you're in the right profession or not. The second one is identify your weakness in your studying, in the sense that you need to understand, what did you lack on? Did you only do questions? Did you only do like YouTube videos? Or did you do like a mixture of both, but not so much on the questions? So try and see like what changed out of your studying schedule or your studying rhythm, and see like if you should change it in order for it to adapt more into questions. So for me, I used to be like very textbook oriented, like during the first 2 weeks, 3 weeks probably, and not really on questions. So then after the first exam, I think the first one I got like an 82, the second one I got like a 77, and then the third one I got a 55. So from there on, I was like, you know what, I'm just gonna do questions. I'm not really gonna focus on the book, and yeah, I'll just do a lot of questions, YouTube videos here and there, and if I have to, then I'll use the textbook, but I'll pretty much gonna learn my concepts based on questions, YouTube videos, and a little bit of textbook if I have to. And then yeah, it began to work a lot. So identify the ways that you're good at studying. Everybody has a different metric. I've told students to do my metric, and then it helped them. Others have been worse. So you need to tailor it down to what fits you. It's kind of like a diet. You know, if you have like a bodybuilder you follow and you want to follow their diet, it might not work the same for you because of different metabolism, different other genetic factors. So don't think that you can just copy and paste somebody's studying habits or rituals and it's going to work for you. You need to find the thing that really helps you and just go from there and tailor it down as you're going. The third one is blaming yourself. So this is really important, and even though it can sound a little mean, it's true. Like, you need to own up to your mistakes, honestly. Like, for me, every time I'll fail an exam, it will be on me. Nobody else failed it. My parents didn't make me fail it. My friends didn't make me fail it. Even though I maybe have gone to a party with them or in a gathering or whatever, it was my choice to go. They didn't drag me and like kidnap me to go, you know. So always blame yourself, own up to your mistake, own up to your responsibility, and from there you're gonna start feeling like, once you take responsibility, once you're the one in charge of everything and making decisions, then you're gonna start feeling like a little bit better overall, because you're owning up to it. And understand that everybody makes mistakes, whether it's that you focus differently because you want to try like something different, your studying habit, and it didn't work. It's fine, you know, it's part of the learning process. It's like hit or miss. So blame yourself for it, because you're the one taking the career, you're the one making the calls, you're the one making the decisions, and you're gonna be like beginning to own some responsibility, and overall it's gonna help you in becoming a better nursing student, a better nurse overall, just taking responsibility. The fourth one, really important, is don't forget that feeling of disappointment, that feeling of embarrassment, that feeling of like imposter syndrome. Just remember that feeling that you had. And with me, it was very crucial to remember that feeling, because every time I wanted to lack a little bit, like maybe study a little bit less or take more breaks than usual, I would just remember that feeling that I had when I failed, and I'll be like, you know what, I don't want to feel like that again. So I'm probably going to study a little bit more, just in case I do fail. I'm not going to feel as guilty as before, because most of the times whenever we fail, we did try something new. We went out a little bit more, we did less questions, we watched less videos, so we changed something in our studying ritual formula. So whenever we do fail, we do feel like guilty, because we're like, oh damn, like I did something different and it didn't work out. And so don't forget that feeling of guiltiness, disappointment, and you're gonna see that every time you want to take a little break or another break more than usual, just remember that feeling, and you're gonna probably go back to your tracks. Again, not trying to be counterproductive in the sense like don't take breaks and just study and you don't want to have that feeling again, because you're going to be overwhelming your brain, you're going to be overwhelming yourself, and it's going to lead to catastrophic, or what would that word be, like a chaos, like a chaotic environment, I guess, because now you're going to be like you're going to have all these anger issues, you're going to be all in a bad mood whenever you're studying. And studying is supposed to be kind of fun in the sense that you're supposed to like what you're studying. So if you make it all unpleasant, then you're not going to want to study, and you're probably going to change careers, change majors, or give yourself a break because you don't like that environment and you're making it like that. But it doesn't have to be like that. So don't forget that feeling of disappointment and anger, but do take your breaks when you're scheduled to take your breaks. It's really important for you to take the breaks. Remember, we're not machines, we're humans. So whenever you study, take like a 5 or 10 minute break. So normally I began doing 25 minutes, 5-minute break, and then I went 30 minutes and then 5-minute break. Then I went to 40 minutes and a 10-minute break, and then 50 minutes and a 10-minute break. You know, that's how I began to go as my weeks were going by. So it's kind of like a muscle. Treat your brain like a muscle, in the sense that once you give it a little bit of resistance and you feel like you're doing well, you increase the resistance. In this case, increase the studying time, and maybe increase the break in order to keep a balance, and you're going to go from there. You're going to see how much progress you're going to be doing. And the last one is understand that it's part of the process. Understand that failure is part of the process. We don't like to fail. Nobody likes to fail. But when it happens, it's like, okay, well, it's part of the learning process. I need to learn from this, change my formula, like I said before, and then try it again. And if it didn't work, then change it again, and you're gonna have to tailor it down. And you can ask people how they study and everything, but most of the time, you have to tailor it down to how you handle it, because everybody's different, like I said. So just have in mind that this is part of the learning process, is part of the process of becoming a better student, a better nurse. So don't take it, like I said, personally. Don't feel like it's gonna be the end of the world, but we all been there. Okay, we all been there, and most of us are out of it. And we can tell you from the other side that we understand your feelings, but you do need to own up to your mistakes. You need to identify what is going on in your studying schedule. Maybe you're not studying enough. Maybe you're only doing a little bit of questions, and overall you're just studying like 4 hours a week, and you need more, or you need to go with the tutors. So identify what can make your studying better. Maybe going with the tutors can add more consistency, in the sense that whenever you're in the tutoring center, then you're gonna be forced to study pretty much, because that can be like your studying zone instead of just being at home. Or you can do like 2 hours in the tutoring center and then 2 hours at home and go from there. But always try and tailor it down, make a little bit of experiments if it's not working properly, and go from there. Obviously ask your friends also like how they study, so you can implement like little bits of it, but don't try and take their whole studying schedule and make it your own. Like, no, just try and get a little bit from it and use it for your advantage. And that's pretty much it. And, you know, with me in first semester, I think I failed I only failed 3 exams. One was the 77, which was my second exam. The third exam I got a 55, and then until the last exam, I think in that one I got like a 76. And all the other ones have been like 82s, 84s, 86, and up from there. But yeah, like overall, it's just like owning up to it, and just, I know it's really hard to like stay calm, but understand that whenever you're not calm, you begin doing dumb things or wrong decisions or stupid decisions. So you need to be relaxed, and that way you can, I guess, think a little bit better and rationalize a little bit better and overall make a better decision. There's like an Arnold Schwarzenegger thing that he said, where he was giving a speech, I don't remember where, but he just said like, whenever you're performing, we do better when we're relaxed. So just relax. And he just says it like really simple, but it makes sense. The concept makes sense in the sense that whenever you're about to take an exam and you're shaking, literally just like deep breathing and just like just closing your eyes and then analyze the way that you breathe, you know, that can calm you down. And understand that we all feel anxious, but it's how you handle the feeling of anxiousness. It's all there. It's all based on that, because we are all like scared or frightened or anxious whenever you're a nursing student or whenever you're already in the field. You know, we feel like that, but it's how you control it that matters. That's how you're going to be distinguishing between a good nurse, an average, and a really good nurse. And it's not a matter of like, oh, I was born with this feeling. No, like you build it upon it, and admitting that you do need help and you need guidance from people. Always be open for suggestions, for criticism, and take it the best way, because they're trying to help you. Whether it's a professor, whether it's a preceptor, whether it's someone in the hospital, they're trying to help you become better. So really take those things that they say into consideration, and really just thank them for the time of analyzing whatever thing that you're doing to criticize it, but really take it for the better thing, because they're not trying to be mean or anything, but they just want to make you overall better. So really analyze those things, and don't try and play defensive, because whenever you try and be defensive, like, they're not gonna tell you anything else, because they don't like that. And I've seen it already a couple of times. So always be prone to suggestions and always be prone to change. And yeah, and overall, that's pretty much how we all grow eventually. But yeah, so you guys found this video useful, drop a like. You guys can also follow me on Instagram, where there you can message me. I've been getting like more notifications, and I like that, from like viewers, and like, oh, like I'm gonna be taking my NCLEX soon, like any tips, even though I already have my tips video, but like other tips. So I'm probably gonna be doing another one of that. But yeah, overall, I like that feeling of community in a sense. I like when they interact with me, and I try to respond the best I can. Probably not as soon as possible, depending on what day it is, because I can be out or I can be working, so sometimes it can take a while to respond, like a couple of hours, but it shouldn't pass more than a day. But yeah, thank you so much for messaging me and reaching out. That means a lot. And yeah, now I'm also gonna be posting an Instagram, kind of like a question thing that you guys can ask me, because I'm gonna be doing the 200 subs personal questions thing that can be anything overall, to celebrate that we passed 200 subs. I think right now we're like at 230 or 240, I don't remember, but it's pretty wild. I'm probably gonna post it here, like how many subscribers we have right now. But yeah, I'm gonna post it on Instagram, so you guys can hop in there, or follow me, or just be pending on whenever I put like the story, so you guys can ask me questions. You guys can ask multiple questions you guys want, and the name is not gonna appear there, so probably gonna do it like anonymously. I know there's kind of like a link that we can put through there. But yeah, that's pretty much it. So you guys stick here to the end of this video. Thank you so much guys for watching, and I'll see you guys into the next video. Bye bye.